Good morning. I will present some cases from my clinical praxis. I would like to say that these three people have given me written consent to so that their case can be presented, but I have changed many personal information so that they cannot be recognized. Why I have decided to present this case is, well, it is very, very important to present some cases uh, under the perspective of cognitive behavioral psychotherapy, rehabilitation, and recovery, so that people can understand how this psychotherapy can work and why this psychotherapy is one of the most effective psychotherapies in this world. So, the first case focuses on a young man who is today 27 years old. He lives in Athens and works in Athens. This young man was born and raised uh, until he was 20 years old in the USA, and especially in New York. He's a Greek American. His father is Greek and his mother is a Greek American, and she was born in New York. So both of the parents have decided to um, uh, have their family and uh, uh, to create a family in the United States because they had hoped that the situation there would be better for them as in comparison to Greece. Well, it was very, very difficult for them. They had many financial and social problems and many health issues that they have arisen during their stay in the United States. So they lived there for as family for 20 years, almost 20 years. Um, their son had many problems as a teenager. He had many problems with his mood. He had many uh, mood swings, but many mood swings have been explained through the teenager phase by the parents. But this young man was not a simple teenager. He suffered by substance abuse. He began with substance abuse as he was 15 years old. And for the next 12 months, the parents couldn't understand what is going on. So they seek for psychotherapeutic help in a mental health center, in a public mental health center in New York. And the colleagues there have made the diagnosis substance abuse with comorbidity depression. And they treated them with agents, with pharmacotherapy and cognitive behavioral therapy, individual and group. So they treated him very, very effectively. And the young teenager, have understood um, how dangerous will be to go on with substance abuse. Um, so they treated the substance abuse disorder of their son, but they had many, many social and financial problems in New York. So um, these social and financial problems of the parents have contributed to the fact that this young man was not recovered from the depression. So they decided to come back in Greece, and they live in Athens. This young man is today 27 years old, and he came to me for psychotherapy um, as he was 21 years old. So I refer him to to the psychiatrist with who I cooperate the last years. And the medication, we have made a restart with the pharmacotherapy. The medication changed. And the first diagnosis that we have given was treatment resistant depression. And then we refer both of the parents to other colleagues to begin with individual psychotherapy. We have made some family sessions. The parents, their son, me, and the psychiatrist. We have offered them about 15 family sessions so that we would like to help them to communicate better with each other and not to abuse verbally each other. And after these family sessions, we refer both of the parents to other colleagues. So the young man has carried on with his therapy by me. I offer him 30 sessions cognitive behavioral psychotherapy and then 70 sessions recovery oriented therapy, both of them according to Beck. Um, After 12 months of therapy, we had an enormous, a big change in his psychopathology. He showed a manic phase. A manic episode was very clear, and then the psychiatrist have changed the pharmacotherapy and gave him uh, lithium and antipsychotic agents. During these 12 months, a psychiatrist have given also not only antidepressive agents, but also a stabilizer. My colleague prescribed antidepressive and lithium, and 1 year after that, and although lithium was given, he switched to a manic phase, but we had take our measures quickly, so it was not necessary to be hospitalized. During this manic phase, he was treated only by the psychiatrist, and we had stopped the intensive psychotherapy because during a manic phase, the most important thing is to find um, a functional outcome. The most important thing is to for the patient to be stabilized, to reach a good stabilization, and not to reach psychotherapeutic goals. We have spent about 2 months trying to support him to reduce the manic symptoms, and after about 2 months, he was functional, and we carried on with the recovery oriented psychotherapy. And the main focus during this second phase of the psychotherapeutic treatment was to help him to find a job. We uh, we begin with a realistic goal that means a part-time job, that means 4 hours per day, or 4 or 5 hours per day, and remote. And nowadays, he works in a public sector department 8 hours a day. So this case shows how difficult can be uh, to focus only on one diagnosis. So when you are confronted with depressive patients, and especially with patients who take many antidepressive agents from the past, but they don't reach a remission, then we need to see for the next months how this depressive phase is going to be developed. Are we going to reach a remission of depression, or are we going to be confronted with a hypomanic phase or manic phase? And so nowadays, the diagnosis of this young man is treatment-resistant bipolar disorder. He's very compliant to pharmacotherapy, and he participated in our group cognitive, in our program about treatment-resistant bipolar disorder, and especially in our pilot group. This program was presented by me in a video in YouTube. So if you are interested about it, you can see my YouTube video about our books. So this young man have participated in over in about 190 sessions of pharmacotherapy and psychotherapy, and he recovered. He can work right now, but in a public sector, and he was evaluated uh, from the Ministry of Health, and he has a percentage. He's over 65%, or he has over 65% of disability, and with this percentage, he could have he could work in a public sector. So the life of this young man was very traumatic, but it is very clear that that bipolar disorder can be expressed during between 10 and 20 years old, and not, of course, after 20 years old until 35 years old. But it is very, very traumatic when bipolar disorder arises during this teenager phase. they don't have the time to reach important goals of their life, to finish a university or to finish um, to finish the school without difficulties. Um, but even if it is very, very difficult, Greece was for him a very important place. He felt and he feels right now safer in Greece as in the United States. And that's the reason we try to help him all these years so that they can make a restart as a family. Parents have participated also on psychotherapies, and they have some financial problems, but they have find a way to make a restart in their own lives. And this is very, very important in our lives to make a restart, even if it is very, very difficult. So the conclusions from this first case study is that bipolar disorder is a very difficult diagnosis. We need many months so that we can treat and we can uh, evaluate the progress of the psychopathology. And the evidence-based pharmacotherapy and psychotherapy can be very effective by bipolar disorder, even if the switch between the phases can be very easy. So the second case focuses on a woman who is now 62 years old. Um, he, uh, she sought for psychotherapeutic help 3 years ago. Um, she suffered from a histrionic personality disorder that was very, very clear from the first session. And she was confronted with very, very difficult moments as a child and as a teenager. She was verbally and sexually abused by her father until the age of 10 years. Her mother died as she was 12 years old after the mother have learned the truth. The daughter have explained her mother what was going on in the family, and the mother had died. So the sister of the mother had helped this young uh, child, and she was raised from the 12th years old until 20 by the sister of her mother. Um, she didn't participate in any psychotherapy until she came to me. And she came to me because he was very, very depressive. But she was, and she is a very competent woman. She has studied, and she has also a PhD in finances, and she works in her own company. Uh, so I was wondering how this woman uh, could achieve so many goals without making a psychotherapy uh, as she was younger. But she did it. She reached all her goals, but she didn't make her own family. That is not the problem. The problem is not if you have your own family or not. The problem is if you're functional and if your life makes sense for you. So she was very depressive as she comes to me. I have referred her for psychiatric evaluation for, and she was under antidepressive medication. She suffered from depression, from PTSD was the main diagnosis. All these pictures of abuse was every day in front of her as intrusions. She couldn't sleep. She was very vigilant, and she had the uh, she said every day, "I'm going to die, but I'm not. I don't know why." And this is very very uh, typically for people with PTSD. Um, she suffered from PTSD and comorbid depression and treatment-resistant depression. So we began with an antidepressive psychotherapy. That means we tried to build an activity plan with which she could improve her mood, and then we tried to reconstruct the assumptions and beliefs that are associated with depression. Um, we have gone through 30 sessions antidepressive therapy, and after a little improvement, I had persuaded her to go on with the exposure to trauma. The exposure to trauma is very, very important for these people so they can be free from treatment-resistant depression. So we have gone through this exposure to trauma, some scenes and situation of verbal abuse and sexual abuse by her father. Um, Exposure to trauma was made in about 30 sessions. So we have 60 sessions, depression and exposure to trauma. And after that, uh, we try to reach the uh, post-traumatic growth after the trauma. It means to find a new way of life or to help people who are traumatized. And she developed a foundation because she was rich enough. And this foundation helps um, uh, people with trauma all over the world. And then after this trauma exposure and post-traumatic growth, I try to focus on cognitive behavioral therapy for histrionic personality disorder. So we try to reconstruct all beliefs that were associated with this histrionic behavior. Histrionic personality disorder seeks always for attention. They try to play a role, like the participation in a theater, like an actress. Uh, and she learned to manage her intensive emotions and very negative beliefs alone, with a realistic point of view. So it was not necessary to seek attention from other people. And She realized that this histrionic behavior was associated with a trauma. This was a very, very, very difficult moment, and grief was activated after this awareness. So we spent many, many sessions um, doing speaking about grief. So this case leads to the following conclusions. Comorbidity should be treated with very carefully steps. We begin with depression, then we go to trauma, and then we go to personality disorder. People should understand why they have developed a dysfunctional personality. Trauma has a negative impact regarding the development of the personality. So when we have personality disorders, it is very, very important to search for potential traumata. So I'm very proud of this woman, and I'm very proud of every person who participates in a psychotherapy, because they are deep inside very, very strong people. And nowadays she's very happy, but she has difficulty sometimes to accept her new way of life and her new point of view. So recovery was possible by these cases, by this case, but also by the first case with a young man of 27 years old. And this is very, very important. So psychotherapy, evidence-based psychotherapy, should focus on improving the improvement of psychopathology, functional outcome, and recovery. If this is not the case, then psychotherapy is not evidence-based. It's something else. For example, it's a philosophical discussion, but not psychotherapy. So you have to be very, very careful when you begin a psychotherapy. You have to ask if the psychotherapy you begin is evidence-based. So I'm going to present the last case. He's a young man, 30 years old now. He came to me after a hospitalization in a psychiatric clinic in Athens. He had problems since he was 15 years old. He suffered from cannabis abuse, and cannabis abuse led them to the first psychotic episode. He was hospitalized as a teenager in a psychiatric clinic. Afterwards, after this first psychotic episode and hospitalization, he took medicines. He stopped using cannabis, but the psychotic symptoms was irreversible. So the psychiatrist had told the family that they have to treat him for the next 1-2 years, so that they can see how this psychopathology can be developed. And this is a very important um, uh, this is a very important assumption. We do not give the diagnosis schizophrenia easily. So this person had 3 more psychotic episodes. 2 of them were treated ambulant, and the last one was treated through hospitalization. And during the third hospitalization, or after the third hospitalization and the fourth psychotic episode, uh, it was secure to give him the diagnosis of schizophrenia. And the psychiatrist during the hospitalization, the last hospitalization, have decided to give him clozapine because he suffered from treatment-resistant schizophrenia, and this was a very important decision because when clozapine was given after the first psychotic episode, it could be better for him. Well, he came to me for psychotherapy. He participated in 30 sessions of cognitive behavioral psychotherapy for schizophrenia, according to Beck. And then he participated in our program for treatment-resistant schizophrenia. If you are interested in this program, you can see one of the previous YouTube videos about our books. In this YouTube video, our programs for treatment-resistant schizophrenia and treatment-resistant bipolar disorder are described with details. So this young man had had sessions once monthly with a psychiatrist with whom I cooperated, and 4 sessions by me, 4 monthly sessions by me. It was very difficult to persuade him to find a new meaning in his life. He wanted to die by suicide. He wanted to find a way to not to live anymore. So we spent a lot of time trying to reconstruct this assumption. And now he has been improved regarding cognitive functions, psychopathology, functional outcome, and recovery. And he works by his uncle 4 hours a day. We have cooperated with his uncle, and he works in a safe place, but he works and he's very productive in what he does right now. So recovery was possible for this young person, even if the situation is very, very difficult. There's no dead ends in our life. And I'm very happy that I work with cognitive behavioral psychotherapy and rehabilitation because they are effective treatments. And if the therapy is effective, then we have more possibility to motivate a person to live or to find a new meaning in his own life. If the therapy is not effective, then people with treatment-resistant suicidal risks or thoughts are not persuaded that there is another way in their own life. So the efficacy of treatments is associated with the reduction of suicidal risk, the reduction of suicidal thoughts and plans, and with a new restart in the life. So this is very, very important and ethical. It is very, very ethical to implement evidence-based treatments in order to help effectively the people, especially those with chronic mental health disorders such as schizophrenia. So these three cases are very good examples for implementing cognitive behavioral psychotherapy and rehabilitation in a long term. Um, all these three people have described the same thing. Oh, I know what the therapy does, why this therapy something does, and what is the goal. It's very, very important to know why we do something and where do we go. This transparency makes people's life very meaningful. Uh, I'm very glad, I'm very proud of all the people who participated in such therapies. Um, and I'm very proud of the science. Without scientific research, it would be not possible to develop such as an evidence-based psychotherapy and rehabilitation. I mean the cognitive behavioral psychotherapy and rehabilitation programs. So even if the life is very difficult, there's always a way to escape from this negative context and to find a new meaning in life. So don't be afraid of psychotherapy. Just begin with that, and you are going to be confronted with many progress, and with a dynamic structure of yourself. So uh, you are more strong as you think, and psychotherapy can activate your resources and strengths. So psychotherapy is offered nowadays in all over the world by many competent colleagues. The main uh, rule for psychotherapy is to be to have a training in cognitive behavior psychotherapy, to have a training which is uh, 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 offered from an organization, from a licensed organization, and, and which is accepted by Beck Institute in Pennsylvania or EABST, the European Association for Cognitive Behavioral Psychotherapies. So, as consumer of psychotherapy, you have to ask your therapist if he's trained and where. And if it is everything okay with the training, then you can begin with safety and security your psychotherapy. So I hope these cases gave you a good example of how psychotherapy works. I would like to thank all these three people for giving me the opportunity to present the cases, and I'm very proud of them. So I wish you all the best and take care of yourself.